Hi, this is Dr. Buford. We just wanted to do a little anatomy evaluation. This is a right shoulder. This patient is in the lateral decubitus position. And we just have a real good shot of the anatomy in the anterior superior quadrant of the shoulder. This is the middle glenohumeral ligament. Now this is an 18 gauge needle, just to give you an idea. And you can see how wispy this middle glenohumeral ligament is. That's the entire ligament. So at least in this patient, this would not be a structure we could target because the needle would just pass right through it, as you see. Okay, you can see how wispy that middle glenohumeral ligament is, okay? Behind it is the much more substantial superior edge of the subscapularis tendon. So this that I'm touching with the tip of the needle, that's the subscapularis. You can see how it runs at an angle and it inserts up at the top here into the lesser tuberosity of the proximal humerus. So this is the leading edge of the subscap. Arthroscopically, we can only see about the superior 1/3, or maybe at most 1/2, but this is all subscap tendon here. You can see the edge there, okay? And here's the middle glenohumeral ligament crossing the subscap right there. So there's a pretty good depiction of the middle glenohumeral ligament. Now down below, we will see the inferior glenohumeral ligament. Lift up on the shoulder. Okay, so we'll get our orientation. So here's the middle glenohumeral ligament. Paralleling it, but more inferior, is the inferior glenohumeral ligament. This is it. This is the labrum, the IGL, or inferior glenohumeral ligament. It's this fold in the capsule right here. Okay? There it is right there. So it's a little bit more robust structure, a little bit more of a capsular thickening than the MGL, which again, here's the MGL right here. Okay? Here's the inferior glenohumeral ligament. And then running up to the left down here below is the subscapularis tendon. Okay. Now this is the glenoid. Now this is the posterior aspect of the shoulder. You can see here there's no significant posterior band of the inferior glenohumeral ligament in this particular patient. Okay. And those are the two major ligaments in the front of the shoulder that we can see. As far as the superior glenohumeral ligament, we can't really see that because it would be behind the biceps, and that's not really a structure that we can typically see and target arthroscopically. Hi Lacey, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And here we are just getting our first good look inside the shoulder. You're laying on your side. And the biceps tendon, let me pull back this one great cannula. The biceps tendon is this cord-like structure in between the two great cannulas there. Just evacuating some of the bubbles as we go. And the biceps looks very strong here. The biceps anchor is the area we were concerned about, and actually this is very, very good news. Other than a small little area of fissuring, which is microscopic in nature or in size, I don't see any significant slap injury. We examined your shoulder before we started, and you did have some increased anterior translation, which is a fancy way of saying some anterior instability. And so we might be doing a plication here, and it looks like we'll be able to leave the biceps anchor alone. The rotator cuff, which is up here to the left, looks great. No signs of any problems with the rotator cuff tendon. So we can leave that alone. Now we're looking down the front of your shoulder. And here's the inferior glenohumeral ligament. And then we have the ability to look in the back of the shoulder. And no significant problems there. That's good. Now we're getting our look from the front to the back. And as we look here, a little bit of laxity in the posterior band of the IGL, but really not much. We're basically going off our clinical exam and your symptoms that haven't gotten better. But this is where the normal posterior band of the IGL would be right at the tip of that great cannula. So we're going to take a spinal needle and check our angle here. We'd like to be able to take a cannula and come right down into the glenoid right here. That's going to be a good angle right there. here. So we'll go ahead and get that done and show you some more in a minute. We've got our guide in. We're going to go ahead and place that on the edge of the glenoid right here. We'll take our drill next. Here we've got our sutures in, very solid as I tug on it. We've got a dry dock cannula coming in the back of the shoulder. And next we'll take one suture out anterior. And so in order to do that, we'll take one suture. And just pass that to the front here. We're just going to pass that off. Back on the brain here. And we just want one, so just take that one like that. Okay? And so now we're going to take a rag and use this to just roughen up the capsule here in the labrum. This instrument just has some sharp points on it, as you see. Okay? Trying to create a healing response. Basically, we're trying to make this capsule sticky like a piece of Velcro. Okay. Grasper. Pause, please. Okay, so now we've got an instrument called a suture hook in. Let me show you. This is it here. It's loaded with a black wire called a shuttle relay, or a super shuttle. Okay. Capsule. Let me get this through and show you some more in a minute. Here's the first half of our stitch, and now we're going to bring that tip underneath the labrum. Through the labrum, we'll go ahead and feed that shuttle relay into the joint and retrieve it in just a minute. Pull back on the first stitch. We're going to do this as a mattress stitch, which means we're going to pass the second suture back to the front of the shoulder. So we're going to take it from the back here, and we're going to pass it there. And now we're going to do that same type of stitch one more time. Pause. Our plication in the back, you can see how that's really created, it looks almost like a wall, doesn't it? It's created a nice bumper for us. And now we're going to have a look down the front. Okay, so we're looking now from the front to the back, and now we're looking, focusing on the anterior part of the shoulder. And so from this vantage point, we can see this is the anterior band of the inferior glenohumeral ligament. You can see it running here. This is it. It's thickening. It inserts into the labrum. This is the labrum here. This is the articular cartilage. This is the front of the shoulder. Way over here is the back of the shoulder. So this is the anterior glenoid. This is the posterior glenoid. We're looking from 12 o'clock. 6 o'clock would be down at the top of the spring. So here's the anterior band of the IGL. It looks like it's there, but clinically it sure was a bit dysfunctional and loose. So we're going to place one more anchor right about here. We'll go through the cannula to do that, so I need the guide.